I'm Sherry. My surgeon is Dr. Pinsky. Back in May of 2015, I happened to come home and, the first thing you do is you take your bra off, get the bra off and do one of these, and I found a lump. So I worked for a cardiac practice at the time, and the first thing I did was I went to my doctor and I said to him, I feel a lump, and he sent me down. We worked in a hospital setting at the time, so when I went down, he sent me mammo, sono, CAT scan, and it turned out I had 7 masses. Dr. Patel sent me upstairs to see the breast surgeon, and with that, she looked through the films and said the mass, which was the bigger one, was uncontained. So I asked her, what are my options? She said we could do a couple of things. I said, okay, well, what's the top 3? She said, 1, we can biopsy it, but if it is cancer, you're gonna die on my table. I said, okay, well, what's option number 2? She said, well, option number 2 is you could wait 6 months. I said, okay, but if it's cancer, what's gonna happen? She said, well, you're probably gonna die. I said, okay, well, what's option number 3 then? And she said, you could get a double mastectomy. You have a huge breast cancer history. My mom had breast cancer. Her sister had breast cancer. My first cousin had breast cancer. And having the history in my family, I didn't stop to think, really. I went in for surgery 2 weeks later. I had really nobody to talk to because my family was going through a lot. My sister-in-law was on hospice. My mom, I felt, couldn't take another piece of pain for herself. So I called my cousin 2 days before, who had survived breast cancer, and said, you're gonna have to take me for surgery. At that time, I didn't know Dr. Pinsky. I didn't really know anything about anything. And honestly, I wish I met Dr. Pinsky 6 years ago. I was having problems with my implants. I felt something weird. My implant was just rock hard. They sent me for a stat CT, and it was a problem. Dr. Pinsky said, you need reconstruction. When he sat with me, he listened to me, which to me, that's why Dr. Pinsky is amazing, because he listened to me. He listened to me and we worked things out, and he did what was best for me as a patient, where it wasn't done. And I said, if you do implants again, what is gonna happen? He said, well, probably be revisiting this again. So he gave me the option and he told me, this is what we can do. So what Dr. Pinsky did was he removed my implants and he did the total reconstruction. So what he did was called a transflap. So he removed the tissue all from my abdomen area, and he created breasts from my body, and he did a reduction. He did what I wanted originally, and he made me feel human again. It changed everything for me. And that was important to me, because you go through all this stuff, getting implants that I didn't even want, I wasn't even happy about, and was so upset coming out with double the implants when I begged her for a C-size chest. I'm not even 5 feet tall. And then this time coming out and knowing that it's gonna be everything that I wanted. And it was just amazing and comfortable, and it's mine. There's nothing fake in there. I don't have to worry anymore. I actually can go to sleep at night and feel good about myself. So my future, I could see my kids get married, and I could just live my life. And that's all thanks to Dr. Pinsky.